And then another question we have a lot is, are autoimmune diseases increasing over time? And the best answer is really yes, no, and we don't know, because there, again, is a lack of data for many diseases. So some work I had been involved with in the UK during the 1990s, I'll just show you a few diseases as an example. On the left, we have rheumatoid arthritis and multiple sclerosis over a decade during the 90s. And for both of those diseases, we saw pretty clear trends that they are, in fact, just decreasing over time. So that's good news. However, with autoimmune thyroiditis on the top right and type 1 diabetes on the bottom right, we saw clear increases over time. And in particular with the type 1 diabetes, something that was also striking was that this increase in rates over time was occurring at younger ages. It was occurring in patients who were ages 0, who were infants through age 14. That's where we're seeing the increase. So it's almost like the age of incidence is shifting at a younger age, whereas we saw relatively stable and slightly decreasing risks for kids once they reach 15. Oh, and just one other point about this is when you do see changes that are occurring rapidly, and in epidemiology, a change over a 10-year span is pretty rapid, we think that points to environmental factors as one of the big components, because if it were purely genetic, we would not be seeing these changes over time so quickly. So we think it's a combination of genes and environment, and these interactions can happen based on the particular genes that somebody has and the particular environmental exposures. And so this graphic is meant to describe, we feel like there's a lot of overlap in genes that might be relevant to several of the autoimmune diseases, but these combinations with environmental factors are what drives the phenotype or the actual type of autoimmune disease somebody gets. So we feel like there's this autoimmune susceptibility, but the way it branches out and expresses in an individual patient might be driven by the environmental exposures perhaps that you're exposed to in the context of your own genes.